Thank you, Riley, and thank you for Center Forward for convening this event today to talk about the federal budget in the age of COVID. As you mentioned, the Concord Coalition has been around advocating fiscal responsibility on a nonpartisan basis for almost 30 years now, and last year we launched a project on fiscal responsibility and economic growth, which I'm happy to say involved papers by two of our panelists today, Doug and Marc, and some very crucial advice from the third panelist, Diane Lim. So what I'm going to do is turn it over to the panel to make brief comments, just introducing themselves. It saves me from doing it and lets them introduce themselves to you. So let me go in alphabetical order by last name. Marc, you're first.
Yeah, we all have last names pretty close to each other, but I picked the big straw.
Appropriately, all in the middle too.
Yeah. I'm Marc Goldwein. I'm the Senior Vice President at the Committee for Responsible Federal Budget, which is another one of those nonpartisan, nonprofit think tanks in Washington that studies fiscal issues, tries to educate the public, and advocates for fiscal responsibility. I've been there for, 13 years now, other than a couple of breaks when I worked in the Simpson-Bowles Commission in 2010 and the Super Committee in 2011. So I'm incredibly experienced at failing to fix the debt.
And I'm Doug Holtz-Eakin. I'm a former director of the Congressional Budget Office, former chief economist at the White House Council of Economic Advisors, and I'm currently the president of the American Action Forum, yet another a not-for-profit think tank, which I founded 10 years ago. AAF is dedicated to doing analysis across the waterfront of domestic and economic policy issues, and our goal is to provide real-time analysis for the events that are happening. Obviously, we've been challenged by the COVID pandemic, and to convey them in English to non-specialists. And so we're happy to be here today and give us our views on what's going on. Diane?
Thanks, Doug. I'm Diane Lim. I am currently the Director of Outreach and Senior Advisor at the Penn Wharton Budget Model, which is a nonpartisan, nonprofit research group that's part of University of Pennsylvania's Wharton School. And we do analysis on the effects of fiscal policies on the economy and the federal budget, mostly longer term analysis, but we've recently been pivoting to do more short-term analysis given the current situation. And I worked with Bob for many years, still work with him very closely at the Concord Coalition and help them out with some of their strategy and positions. Thanks.
Yes, Diane was our chief economist during the last recession, so we're going through our second recession together. All right, so we're all getting used to Zoom panels and Zoom conferences. It's a little bit unusual to be talking to an audience that we assume is there without being able to see you. And the interaction between the panelists can be a little bit difficult with time delays. So apologies for any of that going in. The way that we're going to do this morning is I'm going to give a very brief look at where we were before all of this began. And then I'll turn things over to Doug, who will give some perspective on this pandemic in a historic basis, fiscally and economically. And then Marc is going to talk about what Congress and other policymakers have done so far to address the pandemic. And Diane is going to pick that up and say where we are now economically and give some thoughts about reopening the economy and the challenges of doing that. And then we'll have a general discussion about some of the ideas that are being bandied about for dealing with the problem. And we'll open it up for your questions and then wrap it up, and we'll do that all by 11 o'clock. So with that, let me talk about some of the numbers before all this began. And you don't have to go back very far. If you go back just to February and think about where we were and how different things are now. And this is, really driven by a healthcare crisis and not like the last recession by some economic factors. So it's important to give a reminder starting in that this pandemic has affected over 1.5 million Americans right now. Close to 100,000 have died from it. So it is a very large healthcare problem that has addressed much of the nation. Now, going into this, when it was clear that the pandemic was quite serious, businesses began shutting down. There were stay-at-home orders, and that had a profound effect on the economy. If you look at the fourth quarter growth, GDP growth in 2019, it was about 2.1%, which was not bad. But the first quarter of 2020 was a negative 4.8%, and there are all sorts of horrible predictions for what the second quarter is going to look like, anywhere from around 40% or so drop. That has had a profound impact on jobs. The job unemployment rate went from 3.5% at in February all the way down to almost 15% now. Budgetarily, which is what we're concentrating on today, that has had a big effect because Congress has, and the President and the Federal Reserve have all stepped up and tried to fill in or backstop the economy, which was deliberately frozen in response to the pandemic. So the budget deficits, it's important to look at the trend line over the last 5 years. We had a slowly increasing budget deficit and debt. If you go back about 5 years, the budget deficit, the annual shortfall, was about 4.5% of GDP. This year, it's going to be closer to 18% of GDP. And historically, it's been around 3% of GDP. So we were already on a track with rising budget deficits. The federal budget debt, the total national debt, was around, well, it's going to be over 100% of GDP now. It was around 75% of GDP if you go back a few years. That's been on a trend upward. And the last thing I want to say about that is that we were already on an unsustainable track fiscally, and it was because of policy choices. It wasn't because of a pandemic or a war or something like that. It's important to realize that we had an underlying structural budget deficit that was already on an unsustainable track. And so when we talk about getting back to normal, we have to remember that normal was unsustainable. And maybe we can talk a little bit about that when we get into the broader discussion. So that's where we were. We've had a shrinking economy and a rising budget deficit. And by the way, the Social Security and Medicare trust funds were also projected to be going insolvent within 15 years, and we can get into that a little bit too in the Q&A. So Doug, those are some scary bad numbers. How do they fit into the historical context?
Yeah, well, let me just pick up with something Bob said about how we came into this year with growth at a fairly solid level. And I used to tell people there was no way we could have a recession unless the household sector went south. And what has happened is the household sector has gone south in dramatic fashion. And the most important thing I can emphasize about this event is that it is bigger than anything in our lifetimes by an order of magnitude. Everything you look at is 10 times bigger than anything we've seen before. So we saw in March, January and February were positive growth. And in March, between the 15th and the end of the month, enough things went south that it pulled the first quarter into negative territory with the largest drop in consumer confidence we've ever seen on record. This was followed by the largest decline in retail sales. First quarter GDP fell by almost 5%. 2.25 percentage points of that where people stopped going to the doctor, decline in the use of healthcare. It's just a stunning event that we have never seen before. In April, we lost 20 million jobs. That's 10 times larger than the previous 1 month drop of 2 million that came with the demobilization at the end of World War II. The unemployment rate skyrocketed by over 10 percentage points. That's 10 times bigger than the previous single 1 month rise in the unemployment rate. And the thing that I would emphasize to you the most is that the CBO put out their revised projections yesterday, or the day before, I guess, and they are projecting that during the second quarter, national income, GDP, will decline by 11%. That's 40% at an annualized rate, but it will decline by 11%. In the worst year of the Great Depression, 1932, national income fell by 12%. We are experiencing the worst year of the Great Depression this spring. So when you think about this event, you can't compare it to the Great Recession. You can't compare it to anything we've done before because it is just so much bigger. The mechanism is also different. You know, in the 20th century, business cycles were typically characterized by inventory overbuild, and then you cut back on the production, you close the factory down, you lay some people off. They don't have enough income, and so they stop buying, and it snowballs, and you get a downturn, and eventually they see that the inventories are all gone, and they start up the factory again, call people back, and you get this sort of income-driven but economically founded business cycle. That's not what this is. In the 21st century, 2001, and again, the financial crisis, we had financial market meltdowns, whether it was the dot-com bubble bursting back in 2000 or the housing bubble and credit market collapse in the financial crisis. Those were man-made events. They started in the financial sector. They spilled over into the Main Street economy because business couldn't get access to credit to run their typical operations. And we had downturns as a result. But this is completely different. The mechanism really is the virus came and everybody got shut down. Like the customers went away in an instant. And if you think about, you know, suddenly the virus is here, there are no customers for airlines, hotels, restaurants, concerts. It's just overnight they're gone. They haven't made any economic errors. They don't have business models that are somehow flawed. They just don't have any customers. And in that moment, we had this massive cash flow crunch. Like no one had any money. So what do you do in those circumstances? Well, number one, you try to sell anything you have to get money. And we saw huge financial markets sell off. Dow dropped 13% in one day, for example. And that was just a cash flow crunch that hit the whole economy. Second thing that happened is you don't have any money, you don't pay people. So, you know, the restaurant's cash flow crunch becomes the bakery's cash flow crunch. And we just saw rolling cash flow crunches through the economy. That's not a mechanism that we have ever seen in the business cycle before. And so, you know, that's a big difference. That's what we're thinking about. And then I think the third big difference here is the response, right? The reason this is not the Great Depression is in the Great Depression, policymakers either sat idle or did things that were destructive. And we haven't seen that. We certainly haven't seen anyone sitting idly. The Federal Reserve responded to that massive cash flow crunch by providing liquidity to financial markets on a scale that was simply open-ended. They will provide as much liquidity for as long as necessary, a huge open-ended commitment. We can come back and talk about the details of that if you want. And also Congress acted quickly and on an enormous scale. You know, the numbers are sometimes mind-numbing. You know, a CARES Act that is estimated at $2.3 trillion, but that's about 10% of GDP, and that's about what we're going to lose in the second quarter. The numbers are large because the problem is large, and that I think you have to keep in mind every time you think about this. Bob?
Okay, thanks. Well, Marc, we were looking at trillion-dollar plus deficits for as far as the eye can see, and Congress took action in response to the things that Doug has talked about. So why don't you tell us a little bit about how Congress has reacted? We're not hearing you, Marc.
That's because I was on mute. You know, I use Zoom every single day of my life, but still can't figure out the mute button. I don't want to accidentally put any cheer and positive spin on Doug's, I think, very accurate description of just how bad things are. But there is a couple pieces of good news that differentiate this from the Great Depression. One, there is nothing structurally wrong with the economy, which means that when we solve the public health side of this, we can solve the rest. It doesn't mean it's going to be instantaneous. While I'm an economist, not a medical professional, I'm very optimistic on our ability to produce vaccine at a pace never done before, based on, in fact, we almost definitely already have the vaccine, and we're now just testing and finding the right one and making sure it's safe, et cetera. And so that's the one piece of good news. The other piece of good news, as Doug alluded to, is that the Fed and Congress have responded incredibly swiftly. The Federal Reserve, so we have this new website that I have to promote for a second, covidmoneytracker.org, where we're going to be following all the money from very high level down to, what company is getting it. But by our estimates, the Fed, even though it's technically open-ended, the Fed has essentially committed $5.5 trillion so far into the economy. They've said they'll support up to $5.5 trillion and more if it's needed. And of that $5.5 trillion, $2 trillion is already out the door. They've already done $2 trillion worth of mortgage-backed security purchases and treasury purchases and new lending, and they're creating all sorts of new facilities to give support from everything from large businesses to small businesses to the financial sector to even states and local governments. At the same time, legislation has committed about $3.5 trillion in the near term. Ultimately, that'll be 2.5 because some of it is loans and timing shifts. But in the near term, they've essentially committed $3.5 trillion of support, and $2 trillion of that is already out the door. Actually, or 1.5 to 2 trillion is out the door, which is pretty amazing. On the one hand, I think any of us that have been living this or talking to folks that have lived this understand how frustratingly slow it was for businesses to get their paycheck protection loans, for people to be able to get their unemployment benefits, even for the checks to come. On the other hand, this is the fastest government's ever moved. So we should take some comfort in that. And the money is coming out now. Unemployment benefits are being paid. And for many people, they're getting actually more than they were in their jobs. Businesses are breathing a sigh of relief, at least for the near term, because they are getting their paycheck protection loans from the banks that are forgivable. 75% of the $1,200 checks that we sent out have been received. So the government response has been substantial. It's included support for the unemployed, support for small businesses, support for the Federal Reserve to be able to do some of these lending facilities, even if there could be a loss, which they otherwise wouldn't do. Checks for everyone, some money for states, some money for hospitals, some money for the public health situation. More will probably be needed. I think the first round, the goal was go as fast as possible and get the money out there. Now we have some time to breathe to actually spend the money a little more smart this time, but there are clearly holes in the existing infrastructure we've created, especially for state and local. And small businesses are probably going to need at least a second bridge, as are the unemployed. But it seems like we're on the right track in the sense that we're providing the support. This support, however, is not free. I'm a fiscal conservative, I'm a fiscal hawk. In ordinary times, I believe in reducing the deficits. I don't think we should come into this situation with a $1 trillion deficit. When your farm is burning, it's not the time to worry about if you have enough water for the next 2 crop seasons. You put out the fire. But that doesn't mean that you didn't use the water. And so all of this support for the economy, while it's necessary to prevent the depression, comes at a cost. And that cost is that instead of a $1 trillion deficit this year, we're going to have a $4 trillion deficit. Instead of a trillion next year, we're going to have a $2 trillion deficit. That assumes no more fiscal support. Debt is going to exceed the size of the economy this year. It is probably going to hit record levels, exceed the World War II levels by next year or the year after that. And it is on an unsustainable long-term trajectory that we just made worse, which means when we get to the other side of this thing, it will be even more important for us to bring our fiscal house in order in a gradual, thoughtful, and constructive way.
Okay, Diane, where are things standing now on the economy and how do we transition?
Well, one thing that's been so different about this recession that we have plunged into is that, economists aren't really used to studying recessions in this context, right? One that was not really caused by underlying economic kind of supply side problems in the economy. So I think that where we are now is that economists have sort of been scrambling as to how to talk about and measure how badly off the economy is. And unfortunately, we haven't always had the right tools or the terminology to talk about it in the right context. So an example is GDP. Economists are used to talking about GDP forecasts. If we're talking about a quarterly GDP effect, they put it in annualized terms. But annualized terms, as Doug mentioned, gets you to a 40% drop of GDP. And, I think there's a huge misunderstanding out there when people hear annualized GDP effects And I don't think it's healthy. I think it causes people to, on the one hand, panic about the economic costs and get too eager to reopen, right? Because like that sounds like absolutely catastrophic. And I mean, not that this isn't a bad situation, but it's not that bad. The annualized number means that the quarterly drop would be repeated for an entire year, like would just keep going on, and people don't tend to understand that. It also leads policymakers to maybe aim for policies that would be consistent with a 40% drop in GDP and would be consistent with a longer term recession. And this is a very unique recession in that it is completely tied to the economic activity is completely tied to what we decide to do as a society in terms of controlling the spread of the virus. What is happening right now, what we're seeing happen right now is, of course, states have started reopening. States are not always reopening, understanding the trade-off between economic activity and the public health risk. You know, one thing we have tried to do at Penn Wharton Budget Model is to try to make that connection using an epidemiological model coupled with the relationship between various types of business activity and economic activity, jobs and GDP. And what you see is that as states reopen, they are going to see increases in economic activity, proportional to how much they reopen the economy. The problem is that the public health costs, the risks, grow exponentially while the economic gains grow only linearly. So the problem is that we're likely to see that some states will have relapses in their public health situation because they've reopened too quickly. We're also likely to see that every state is going to be a little bit different in terms of how their population responds to actual policies. So when a state signals different things when they say, okay, it's safe to reopen halfway if you're a restaurant. You know, the way people in their state interpret that news makes a bigger difference than the policy itself. Like people's behavior, like how they take signals as meaning that it's safe to go out and congregate in groups. And, the behavior is so much more important. What we're seeing in the data is that there's real-time effects of behavior that swamp any actual policy changes, that people will do what they want to do. And people are getting impatient right now, staying at home. And so it's getting to the point where regardless of what the state government is saying, people are starting to go out more and starting to socialize more. And so I think what we have to worry about is that while we will see this positive effect on, job losses have already slowed, they're probably some jobs are going to come back because businesses are going to be reopening. We have to worry about whether there will be future pullbacks in state policy in terms of business closures and stay-at-home orders, because I think that we're seeing a decline in cases and deaths now, or decline in the pace of cases and deaths. We're seeing a decline in the pace of job loss, but that could very well pick up again. So there's a new kind of business cycle or epidemiological cycle we have to worry about that the economy's activity is intimately tied to. So it's sort of like we're riding the public health wave, and the economy will just follow along. But what happens to the economy first depends on what happens to the public health crisis. And so I think that, what we're going to see is a slowing of job loss. I think things have gotten as bad as they will get in terms of job loss. We've already seen it. We are up to an effective unemployment rate probably mid-20s right now. You know, the official reading from BLS from mid-April was a little less than 15%, but there's all kinds of issues about how BLS asks the questions to households and what their answers mean, right, in the survey. And we weren't counting people who have since April filed, since mid-April, filed unemployment claims. The unemployment claims data don't count the unemployed who aren't eligible for unemployment benefits. So there are lots of reasons why the real and real-time level of unemployment is probably in the mid-20s right now. That's probably as bad as it will get before people start going back to work. We've probably peaked in terms of, at least this round, we peaked in terms of new cases each day in the US. But like I said, I think we just have to, states have to play it cautiously. States have a public education campaign that they should emphasize even more than whatever their official policy is, to make sure that the residents of their state understand that just because some businesses are reopening is not a reason to go out and get back to, you know, crowded activities like people used to do. So I think we're going to wait and see what happens. And every state is different. Every state's economy is made up of different industries, and we're going to see this play out in real time. We're going to see which states end up going back into a bad cycle and which states reopen in a smart way that doesn't force them to backtrack in the fall.
And I think that is a challenge for Congress as well. It's certainly clear that some additional legislation will probably be passed. There's a lot of disagreement right now. Unlike the bipartisan nature in which the first 4 bills were passed, it seems like there are some partisan splits. And I want to get into some of those big issues. So what I'd like to do now, and we'll go in the same order with Doug, Marc, and Diane, is just looking at the legislative proposals that are out there, which seem the best for you at this time, given the circumstances that we've all outlined, and what do you think are some truly bad ideas that might be out there that you would advise policymakers to avoid? And in your answers, I know some of the big issues that people would be interested in are the role of state aid, and the interesting case of whether or not to extend unemployment compensation at the current level with the bonus, and whether there are tweaks needed to the Paycheck Protection Program, the PPP. So that's kind of general, but I wanted to get everybody's take on the current legislative ideas. Doug?
Yeah, thanks, Bob. I would try to be concise. One could go on for a long time given that range of topics. Let me say as a preliminary thing that the strategy has to change going forward. The basic strategy in CARES was to mimic what the Federal Reserve did for the financial sector and simply flood the non-financial sector with money so that we could keep workers attached to their firms, keep firms in business, preserve the economic infrastructure past the peak of the pandemic for 2.5 months, and then pick up the pieces. So it really was throw money at the problem and ask people to do nothing. Don't lay anyone off. Don't try to close your business, just hang on. Going forward, we're going to have to figure out how to operate the economy in the face of the virus. Like this strategy was hide, hope it goes away. It's not gone. We will have to operate the economy in the face of the virus going forward. It's going to have to be different. And I think people have different ideas than that legitimately, and that's part of the disagreement. It was easier the first time. This is harder. For me, I think the key issue here is going to be that when you operate in the face of the virus, you're going to have to provide the confidence to people to do things, conduct economic activity, produce things, engage in commerce. Governors don't open states, people do. And will they go back to work? Will business owners be willing to open their businesses? And there are, I think, some key aspects of the confidence there that are going to affect economic growth. We will have to reconfigure the way we run some businesses in order to operate in the face of the virus. I've told lots of people, this reminds me of my experience after the terrorist attacks of September 11th, 2001. We had a threat to the American public, terrorism. We had to deal with that, but we also had to figure out how to operate the economy in the face of that threat. So we started inspecting every container that came into U.S. ports. We'd never done that before. You know, we stood up the TSA and changed the nature of air travel forever. We did all sorts of things that cost a lot of money, were the attention of the business community, and came at the expense of sort of traditional economic growth. The objective was security, not growth. We're going to have the same thing here. We're going to have to protect people against the virus. And business owners are worried about being sued, and there's liability issues. They need some confidence. Workers are worried about getting sick, and they need some confidence. So the public health mission remains paramount. You know, testing, vaccines, therapeutics, all of that's important. But in thinking about what we do from a legislative point of view, recognizing those issues is really important. Though I think the worst thing would be to be a simplistic, let's just write some more checks and hope it's all going to be fine. That's not going to help if the problem's on the supply side and getting people to actually show up and work. In terms of that list of ideas that you tossed out, I think the most important issue is this $600 federal bonus on top of the traditional state unemployment insurance benefit. When the goal was to get people to stay home and not try to go to work and support their incomes, that was exactly the right policy. As the goal shifts to get people back to work, it's simply too generous. Our estimates at my think tank are that 63% of America's workers will get more on the maximum UI benefit than they would at their previous job. And so it's an extraordinary impediment to getting people back to work. It's a temporary policy, and most of the things we're doing here are temporary because of the pandemic. So it's going to need to go away at some point. If it's not July 31st, as currently legislated, it should be as soon as possible. It should be phased out so there's not an abrupt cliff. But the most important thing is to provide the ability to have something like that when you go to work. And so some proposals are simply, like as Georgia did, what Georgia said was, okay, if you make less than $300 a week, when you go back to work, you can get your UI benefits. So you just turn that into a portable benefit that comes with work as well with not work, and you get rid of the disincentive to go back to work. I think getting that right is going to be one of the most important things Congress does. There are a list of others that we can come back to in the Q&A, PPP, Fed facilities, but that's the key labor market issue.
Marc?
So again, I could go on for hours about all the ways that I would repair. So I'll kind of stick to broad ideas of where I think we should be focusing from a fiscal perspective. We need to fill in the holes of what we missed. And the number one hole is state and local governments are going to lose a lot of revenue. And we should not bail out state and local governments for past bad behavior. We shouldn't give them money for their pensions or for not having a rainy day fund. But this isn't a rainy day. This is 6 simultaneous tornadoes and an earthquake at the same time. So states and localities are going to need support. And there's other holes as well in the public health space and for insurance, et cetera. Number 2, we need to do what I call extend and repair. The abrupt end of PPP and of unemployment is not going to be healthy, but nor are either of those systems designed as they should be. So we need to extend some form of support for unemployment beyond just the traditional benefit, and we need to extend some support for small businesses. But we need to fix it. We now have time to think about them more closely. And again, I got 6 hours on that if you all have time. And number 3, it will undermine this entire effort if we use the pandemic, if we use this major national crisis as an excuse to pass stuff we would have wanted to do anyway. I'm just going to call out some specifics. This should not be an opportunity for Tax Cuts 2.0 to cut the capital gains rate. That does not belong here. This should not be an opportunity for a multi-employer state bailout or for $10,000 of student loan relief. These are ideas that predated the crisis, that have nothing to do with the crisis, that are not only fiscally expensive, but when we put them on the crisis legislation, it undermines the entire effort to rescue the economy, because if everything's an emergency, nothing is.
Okay, Diane, and as I move to Diane here, we'll go to Q&A at 10:45. So if you have questions that you want to address the panel, start typing them in the chat function. Diane?
Yeah, so let me start with some optimism, and that is, there's a saying, what doesn't kill us makes us stronger. Is that a song by someone? Anyway, there's that saying, what, that, when we have to face crisis, how we come out on the other side, though, really can make a difference, and it can make us better going forward. And I think that one thing that this crisis has done is it's forced us to find new ways of getting our work done, right? And people have adapted pretty well in those non-human contact industries, right? Some of us are lucky enough to have jobs where it's not an essential part of our job that we go around shaking hands all day. So, I think that the technology that we've all been forced to adapt to is actually going to make a lot of work more productive in the future. Like, these are, we're discovering that you can accomplish a lot in terms of what we would have had a live conference for. We can, accomplish a lot over technology, over Zoom. I think that this has also forced all employers to think anew about whether it's true, can someone work from home and still really work from home? I once had a boss that said there's no such thing as working from home. There's only not working from home. Well,
that wasn't
people
me.
have changed.
I don't think I said that.
Not Bob. But I mean, I think people have definitely changed their attitudes about flexible work arrangements, because let's face it, we've all had to be very flexible during this time. I think that people, because there's been such a change for working parents who've had to work from home while their kids are around, that people are starting to think about childcare issues and supporting workers with more assistance for paying for childcare wherever it happens, whether it happens in your own home or whether it happens at a daycare center. Elder care issues. A lot of us are rethinking the fact that our elderly parents are in assisted living homes. As I used to struggle with that decision, whether to keep my father at home or have him live at an assisted living facility where he has full-time care. I think there are risks to a lot of these activities that we thought were good ideas to, congregate in places. I think the economy is going to change once it's recovered, that some industries that were already struggling, such as, retail sales industry, in particular department stores, clothing stores, like, I just don't see how they will come back after this if they rely on their brick and mortar sales. So, I'm wondering about cruise ships, although I have my opinions about cruise ships, but so there's certain industries that I think may go away. So the economy isn't going to come out on the other side in the same form, but I believe that it's going to come out in a better form. Like, we're going to adapt. We're going to look a little different on the other side in terms of economic activity, the mix of things we do, the way consumers like to consume. I mean, one of the fastest growing sectors of the economy prior to this crisis in terms of jobs was the leisure hospitality sector. So, and now it's just the fastest shrinking industry, but hopefully that's just temporary, and that industry will come back. But the nature of leisure and hospitality activities is probably going to change. You're not going to see hotels and casinos as packed as they used to be. People are going to be more interested in taking vacations where they can stay in a house with their family as opposed to in a crowded hotel. So that kind of change in the leisure hospitality sector is definitely going to happen. It probably means that some employment that's gone away will not come back, because if you have fewer crowds, you have less need for lots of workers. The other source of optimism on my part is that this has reinforced the need that all of us on this session have been talking about before the crisis, which is the need to have a good amount of fiscal space in place in order to be able to address emergencies like this situation, crises. I think that this crisis has definitely taught everyone, policymakers and the general public, has reinforced the need for a good, strong government and a fiscally sound government so that we have the resources to come in to swoop in when needed. I think it's also reinforced the nature of the importance of state and local government. So in this particular kind of crisis, especially where every different states face different situations, and really the best policy response is that which is geared toward the nature of your own economy and community, where you can see where the needs are. So I think that what I would like to see, I do believe that state and local governments are bearing a huge burden right now, and appropriately, because the state and local government is best one able to administer assistance during this time. And therefore, I think that I would like to see more assistance from the federal government to state and local governments, because state and local governments just simply don't have the resources to do it themselves.
Diane, I'd like to say that your version of optimism is an interesting one, that we can all now start thinking about how bad the situation was before we got into this pandemic. And
oh well, I mean,
I think that's. I'd take that in a heartbeat. Let's go back to talking about a sustainable budget when the projected deficits were, trillions of dollars, $1 trillion rather than $4 trillion. I wanted to get to the question. There's one question that and this can be a lightning round specifically for Doug. Did you ever think a CBO director would be issuing reports that are based on estimates of social distancing?
There are so many parts of this that I did not anticipate. That's definitely on the list.
That really struck me as a consumer of CBO reports. And
Yes.
I mean, they have to do it, but I mean, it really highlights the uncertainty of all this and the unprecedented nature. We've gotten a number of questions, and I'm going to try to combine a couple for the sake of time. One has to deal with what effect this will have on the long-term situation. I mean, this is going to be like a one-term blip, and then we start just from a higher level of debt with the same problems, and so what's the magnitude there? And also the huge amount of borrowing that we need to do, does that have an effect on the U.S. credibility in international credit markets? And is there some fallout from that, either in terms of inflation or interest rates, that we need to worry about? And Doug, why don't we'll just do same order.
So briefly, I mean, to date, the response is very targeted in 2020 and 2021, big increase in the deficit. And then we go back to the old problem, a baseline outlook that showed deficits as far as the eye could see, growing in magnitude, and debt relative to GDP spiraling north without cease. So we're just going to face that old problem from a higher jumping off point, over 100% of GDP. So that's roughly sort of where that is. I don't think there has been any evidence of negative fallout of the large amounts of borrowing. The auctions have gone well. People still have an appetite for treasuries. And among the reasons for that is that in economics, everything is relative. So are you going to get a US treasury, or are you going to go get some other country's securities? We are doing better than the rest of the world. It is also affected by the pandemic. It came into the pandemic in worse shape than did the United States. And so economically and budgetarily, we have lots of problems, but we're still in better shape than our competitors.
I want to push back a little bit on that. Not that I think that our debt issuance is going to be a problem per se, but we're mostly, in terms of what we're successfully auctioning, we're mostly auctioning right now very short-term debt, less than a year. The vast majority of what we've been selling is really short-term debt that people want liquidity. People are not buying medium and long-term bonds at 1.5%. They're not. In fact, in total, on average, 100% of the debt that's been issued since since mid-March has been bought by the Federal Reserve. Yeah. Not directly; they don't directly buy it, but indirectly, the Federal Reserve has bought as much debt as the Treasury has issued, and they've essentially been buying the medium and long-term debt, whereas the Treasury's been issuing the short-term debt. So I'm not actually convinced there's a $4 trillion deep Treasury market, at least not at current interest rates. But we're lucky in that the Federal Reserve is stepping in. And so long as the Federal Reserve has...
I think that doesn't mean anything, because there isn't the need for a $4 trillion Treasury market outside of these circumstances.
That's right.
The definition of these circumstances is the Fed needs to buy a lot of this stuff, and
that's right.
We need to issue a lot of this stuff.
Yeah, no, I agree with that. I agree with that. I was just saying, I don't think it's just the case that we could issue $4 trillion of debt because we're more attractive than, we're the finest horse in the glue factory. I think we can issue it because the Fed right now, we can issue it at such low rates because the Fed is buying it. And so long as the Fed has credibility that when we're on the other end, they're going to stop buying it, and they're going to, if there's inflation, they're going to take control of it. I don't think that's a problem. I think the Fed has the ability to monetize this debt at this point. But there are long-term risks associated with it, which means that there might be greater inflation threats or reasons for higher interest rates in the future. There may be more crowd out or less private sector investment. So I don't think it's a free lunch, but nor do I think we're in any crisis of not being able to issue our debt.
So
Diane, before you weigh in, Diane, I want to add another element that came up in another question to all that mix when we're talking about the future of the federal budget and what effect this might have. Is this something that can be, we're going to have to, basically, we're going to need more revenues. And if you do that, is the income tax, can you do that on the income tax, or we're going to have to look for different ways of raising revenue?
Do you want me to answer that right now?
Sure.
Should I weigh in? Okay.
Yeah, no. I mean, because we're talking about the fiscal sustainability.
We were talking about how we needed new sources of revenue even before this crisis, right? So I think that anything we were talking about before, like whether it's a carbon tax or a value-added tax as an add-on rather than a replacement to the income tax, those are all things that should be considered for the future. We also should get back to looking at income tax reform, and that broadens the tax base, right? That allows us to raise more revenue without raising marginal tax rates. Although I do feel like raising tax rates almost looks like a silly, and the disincentive effects of higher marginal tax rates right now kind of looks a little bit silly of a issue to worry too much about, given how low our marginal tax rates still are. So I would like to see more base broadening in the income tax. I would like to see, us to try to reduce some of the exemptions and deductions under the income tax. I would like us to consider add-on revenue bases like we've talked about for decades now, is adding on, new tax bases. I think that another source of my optimism is I'm hoping that we're going to see less of this clamoring and lobbying for particular types of tax preferences under the guise of this will be great for the economy, because they all look like tiny little things, and they cost a lot of money, and they look honestly a little bit silly to talk about, to go push for your favorite tax break for your industry just makes you look really silly right now. So
I'm not sure I would rely on that.
Yeah, that's a very optimistic take. Just wait for all the tax credits, the pandemic recovery tax
has
credit.
always been so successful as a public policy.
So I think that it's up to us to the policy experts to stress that we do not want to use this crisis as an excuse for enacting and passing and enacting permanent policies that are basically bad ideas for the long term, right? And that's why I stress that, I don't like it when people hype up the negative economic numbers, because it gets people and policymakers to thinking we need to do something really big, we need to pass some really great supply side tax cut or whatever their favorite subsidy policy is, and we need it to be big and permanent. So I think we all need to emphasize this is a temporary condition, and whatever fiscal treatment we put in place should be well designed to to treat the particular condition, and should not commit large amounts of federal resources for the indefinite future. So,
Well, a very wise.
Can I agree and disagree on that?
Yeah.
Yeah,
I by and large agree, and I want to say that. But if you look at what CBO put out in terms of its forecast, which is sort of typical of all the forecasts at this point, you can get whatever you want out of that in terms of the alphabet letters of recoveries. You go down at a 37% rate in the second quarter, up at a 21% rate in the third quarter, and that's where you hear the administration talk about a V, and they point right to that.
yeah,
Go to the fourth quarter of 2021. GDP is still lower than it was in the first quarter of 2020. The unemployment rate is still 8.6%. And to address that, I think you do need some things that are more durable and focused on the trend rate of growth, so we can get those folks back to work. I don't want to do a bunch of short-term stimulus, and I endorse wholly the mission drift threat. I mean, but we do have to worry about doing something that steadily takes on this protracted unemployment.
right.
I know that another big issue that is in the mix and can't be avoided because we were talking about it before the pandemic, but what is the role of the federal government in healthcare? I mean, does that change at all? There's certainly been, during the campaign, there's been a big push for universal coverage, but there are different ideas out there, and then a big healthcare pandemic hit. So the future of the federal budget is heavily tied to the future of healthcare costs and how we finance it. And I know all three of you have spent some time looking at that. So Marc, you're the last one that hasn't spoken, so let me start with you on that one.
Well, first of all, I think this is going to be the first real test for the Affordable Care Act. This is the number of people that are going to lose their employer insurance or already have is larger than anything we envisioned. And it's a real open-ended question. How many of them will be swept up by Medicaid and the exchanges, and how many of them will still be uninsured? I do think that some are going to push for Medicare for all as the solution to this, but they mostly push as Medicare for all as the solution for everything. So I'm not sure that tells us too much. But this is going to be a real test for how much our healthcare system can handle a bunch of people without employer insurance. At the same time, healthcare costs are going to be way down this year because people are canceling elective and even not very elective healthcare. But the trend is still in the wrong direction. Healthcare costs are rising dramatically, and that's going to be even more painful if the composition of insurance changes. So we got to get that under control. And things that made a lot of sense in this emergency, like allowing all doctors to offer telehealth, could be really dangerous, medium and long term, if we don't figure out how to do it in a more thoughtful way.
Doug?
I don't see a dramatic change. I think Marc's got it about right. The key policy issue will be what happens to those who become uninsured as a result of the layoffs and restructuring of the economy going forward. And that's a coverage issue to which we have achieved no political consensus, for decades. And I don't see that changing during the course of a couple of months in 2020. Not real happy about that, but that's where we are.
Well, I guess Marc was real happy about the prospects for big deals.
Yeah, I think
these underlying conditions have been resistant to political change, and
Yes.
Unfortunately, it's probably going to be the case. Diane, real quick, we've only got a couple minutes left.
Yeah, I just want to say, I think that, the one thing the crisis has underscored for me is that there are challenges in having a benefit system that is so tied to the traditional employment relationship. So I think that, I think that we've moved, I think that there's more argument for having a more active government role in providing healthcare services, even if it's just to give people an option outside of the traditional employment relationship.
I see heads moving in different directions.
30 seconds.
Yeah.
As someone who was the author of a sweeping plan to move coverage outside of the employer system, forget it. People love employer-sponsored insurance. You change it at your own political risk. Rational arguments not.
Yeah. Okay. People love it, except the people that don't have a traditional employment relationship.
It's not a logical issue. I'm just saying the facts on the ground are what they are.
Yeah.
All right, I want to ask one last question here. Oh, Mark, go ahead. Yeah, go ahead.
No, ask your question. We could go 20 rounds on this.
Yes,
Go ahead.
we have.
Well, listen, I just I want to get into this urgency of action question, because one of the tensions on the Hill now is, no, we have to act fast versus no, we have to let the stuff that we're already done seep in and see if it works. So last question for the panel: what's your sort of the gauge of urgency of action? When do you see it happening? When do you think it should happen? The next.
I can jump. Okay, go ahead, Dave.
I think that we do have to fill in some gaps, as Marcus, I think, pretty eloquently put it, and that has to happen before the end of June for sure. Somewhere in that window, that's got to be done. The outstanding sort of question from the CARES episode remains the Federal Reserve lending facilities. Main Street hasn't delivered any money, neither has the state, local, municipal facility. There's $500 billion backstopping that, which gives me levered into $2.5–3 trillion worth of lending. If that all goes out as these things get stood up in the next month, then that changes dramatically the way you think about the next legislation. So that's an important piece of data.
Yeah, so first of all, we do not have to act nearly as quickly as we did with the CARES Act. This is not like we got to pass this tomorrow emergency. We have time to sit and think, but nor will we have time to wait to see how everything has played out. There's some deadlines coming up. The Paycheck Protection Program essentially ends the end of June. The fiscal year for states is July 1. The unemployment expires July 31st. And so we're going to need to address those deadlines. Ideally, we'll have a strong enough political system that we don't have to do everything at once, right? We can keep coming back over and over again as we learn more. That's what we should do. To the extent we can't do that, putting in place automatic triggers for some things makes a lot of sense. They can't all be tied to the economy, because in some cases they'll be self-reinforcing. We need to look at how to tie some of these triggers to the public health and social distancing situation. But in general, I'm a favor of those triggers where they don't go overboard.
Diane, and speaking of deadlines, we're at
No,
about.
I agree. I agree. I
So-
agree with everything Doug and Mark just said. Yeah.
That's a great conclusion on a note of consensus there. So let it be said. Riley, I'm going to turn things back over to you if you want to thank the participants. And let me just thank the panel and thank Center Forward for letting us come and spew forth our thoughts for an hour.
Well, I would echo that. I really appreciate you all taking an hour this morning to join us. We had a really great conversation. This was super helpful, especially for all of the congressional staff that have tuned in. And I would just add to that point, if there are folks who are tuned in and watching this and want to follow up with any of our panelists, please reach out to me. I'm happy to forward your requests and follow up with them on your behalf. And with that, thanks again to the panelists, and everybody have a great rest of your week.
Thanks.
Thank you.
See ya.